What is happening, my people? Dr. Z here in ZuluTime, episode number 147. And today we're going to be talking about type 2 diabetes. We're going to be talking about diabetes secrets. This is the Diabetes Secret series. And then we're going to be talking about the truth behind type 2 diabetes. So, if you suffer from type 2 diabetes, if you know anybody who suffers from type 2 diabetes, listen up. This is exactly what they need to hear. This is exactly what you need to hear. Something I didn't know when I started my journey in healthcare, in medicine. It took me many years to realize all of this. So first, we're going to be talking about why are we treating type 2 diabetes in the wrong way. Second, we are going to be talking about why we need to change the way we look at type 2 diabetes. And then we're going to be talking about why most people don't overcome diabetes. So the first thing is, why is it that we're treating type 2 diabetes in the wrong way? Well, the truth is, even though diabetes is like this hat of a term, the truth is that it's completely different. Type 1 diabetes from type 2 diabetes, in essence, they are two different diseases, almost the opposite. You see, type 1 diabetes is that there is no insulin in the body at all. Type 2 diabetes, there is too much insulin, and the body is actually resistant or not responding to insulin. So they're completely two different diseases. Now, do you know out there, anyone knows out there, if type 1 diabetes is more than type 2 diabetes? If you didn't know, type 2 diabetes is actually 90 to 95% of all diabetes. So is most of the diabetes out there. And you see, in type 1, insulin helped, because in type 1 diabetes, as we've talked about before, the lack of insulin is what's happening in the body. That means the pancreas is being attacked by its own body, by its autoimmune system, and then we don't make any type 1, any insulin at all. So that's why when we shot people with insulin, when we shoot people with insulin, it helps them. But in type 2 diabetes, it masks the problem. It helps them for a while, but it doesn't help them get rid of it. So in type 1 diabetes, there is no insulin, therefore insulin works. In type 2 diabetes, there is too much insulin. So when we give insulin, which is a growth hormone, things get worse over time, and people never get better. They will keep coming to the office until they pass. And so if you are a diabetic right now, listen up. Type 2 diabetes, insulin is not the way you want to treat your disease completely. It helps you maintain your body and sustain life, so it's hugely important, but it is not the root of the issue. So listen up, right? This is not trying to change your doctor's prescription. This is not trying to change your doctor's advice. I am just saying here that the root of type 2 diabetes, it is not the lack of insulin. It is actually too much insulin. Is insulin resistant. The body has become resistant to insulin. So you see, in 2001, less than 3% of adolescents that were diagnosed with diabetes were actually type 2 diabetics. Less than 3%. Now, in 2011, is 45%. It went from 3% to 45%. That lets us know that this is a huge problem in the adolescent community. We have to get a hold of this. We have to get a hold of this epidemic for our kids. And so it develops gradually, and goes from just regular person to pre-diabetic to full-blown diabetes. But this is why we are treating diabetes in the type 2 diabetes in the wrong way, because we're treating it as if it was type 1 diabetes. So why we need to change the way we look at diabetes? Well, because when we say diabetes, we all are thinking about some disease that where the body cannot deal with sugar. That is very true. But we get all confused about type 1 and type 2. We think that type 2 diabetes is treated like type 1 diabetes. Well, type 2 diabetes is very different than type 1 diabetes. So we need to change the way that we look at this disease, because otherwise people look at it this way and we will never be able to overcome this problem, because people just take medication after medication thinking they're going to get rid of the disease. They don't get rid of the disease, they just mask the symptoms. You see, the problem was that when scientists discovered insulin, we thought that we had the big eureka moment that, like, oh, okay, diabetes is cured forever, but that is not absolutely true. The invention or the discovery of insulin helped save many people's lives, especially type 1 diabetics. It was amazing. Like, kids were able to live longer now. Like, it was amazing, but it is not the cure for type 2 diabetes. It can help you mask the problem, but type 2 diabetes can be treated very differently, right? And so when insulin secretion um, fails to pace with insulin resistance, that is when glucose levels start rising. That is when type 2 diabetes start taking a hold. So again, when our bodies is secreting insulin to deal with so much sugar, but the insulin doesn't work anymore. So when that happens, that's when the glucose levels start rising even more, and we end up getting type 2 diabetes. Some points we need insulin absolutely to get rid of the sugar from the bloodstream, so it's not life threatening. This is very important. But the actual root of the disease, it is not lack of insulin, right? And so why most people don't overcome type 2 diabetes? Well, first of all, because they don't know what we just mentioned. They think that it's the same as type 1 diabetes. They think that with insulin and with anti-sugar medications, they're going to be able to treat this disease. But the truth is, it's far from the truth, because it's very different than type 1 diabetes. And really, to be able to deal with the root of the disease, we can look at a study that was done in Ireland, where 86% of the patients were actually had complete remission of type 2 diabetes by 15 kilograms of weight loss. So diabetes is very associated with obesity, right? And so that's why the term diabesity has come into play, because it's very related. And we know that obesity and any chronic disease is very related to adverse childhood experiences, to belief systems that we have incorporated into our minds. So mindset is going to be very important to be able to deal with this patient, so that they can create a new identity, that they don't have to live with type 2 diabetes anymore. So today in ZuluTime, we talked about why are we treating type 2 diabetes in the wrong way? Why do we need to change the way that we look at diabetes, and why most people do not overcome diabetes? So now, that was it for ZuluTime today. Next episode, we're going to be talking about the complications of type 2 diabetes and diabetes. We're going to be talking about how diabetes wrecks our bodies, our eyesight, our kidneys, our nerves, our heart. It really just creates so much problems in the body. And so that is it for today. And again, this is Zulu Time, episode number 146. Subscribe, share. The goal is so that we share this information so that people stop unnecessary suffering. All right? Until next time, Dr. Z here. Take it easy.